Great to hear you. All right, good morning, good afternoon, dear viewers, friends, and colleagues. Welcome to the channel Innovative Sustainability. Today, we will be talking about healthcare, returning basically back to that topic. Today, our guest is Galina Slezinger, and she's joining us from Massachusetts, from Boston, right? Um,
Hello,
hello. And Galina, welcome. It's a pleasure to see you again after so many
thank
years.
you.
Galina was my colleague at Brigham and Women's Hospital, and we worked together on different floors, but the same team. So it was great. Galina, welcome. The floor is yours. So please begin.
Thank you. It was a great pleasure to work with you many years ago, and I always have wonderful memories of our time
Sure,
together.
sure,
Um, so, uh, we're going to discuss today sustainability and marketing in the healthcare sector. And basically, one of the most important aspects of sustainability in healthcare is environmental sustainability, where hospitals strive to become more and more digital. Um, you know, this means hospitals try to reduce any printing capabilities, um, paperless communication, like digital campaigns and newsletters to patients and to employees, um, and just overall digital presence for a hospital that can reach a lot more um, clients and patients across uh, the area. And then what's another important aspect of sustainability for healthcare sector is social sustainability, which focuses on community and access to care. Um, in marketing over many years, the important aspect of that is to promote health programs, education, um, and such things as promoting to patients how important flu shots are, mammogram screenings, and like online exercise classes. So giving patients and clients capabilities of reaching those kinds of um, initiatives virtually, not only physically, which gives many people more capabilities to do that. And then another important aspect of sustainability is economic factor. Marketing. In marketing, we promote clinics and we promote virtual visits, like I've mentioned prior to this, where we try to reduce visits to emergency room, which saves resources for the hospitals. And at the same time, it saves resources for patients also if they're not able to physically come to the hospital sometimes. Those things are very important. Sustainability in marketing in medical environment also means promoting responsive marketing, meaning we making sure that we provide accurate information to patients, being compliant in patient privacy. For example, um, we receive a lot of Google reviews online, and we're not we're able to answer all those reviews, but we're not able to really disclose any patient information, and that's an extremely important piece of patient privacy. um, you know, what's important, I think, in sustainability is also innovation. And innovation for marketing perspective in the healthcare factor is, we're more and more data driven. You know, a lot of um, healthcare industries, use AI to predict and demand productivity, and we use a lot of analytics, data analytics, um, automation in marketing, platforms such as social media, where you can automate, a post, for example, of a flu shot, and you automate that throughout all platforms, whether it's Facebook, Instagram, and all digital social platforms. Um, Digital first marketing um, means that we provide things like QR codes to patients so that instead of printing brochures, we can provide QR codes. People can download them on their phone and get all the information from the get-go. Um, we also strive to, again, not to print posters and things like that. So we provide, many healthcare industries provide things like digital TVs where you advertise everything through digital boards, different digital channels. Like, for example, there's a cardiology department, they will have their own channel, and all the digital boards will advertise the events happening for cardiology for patients or important information um, that we need to convey to the public. So that's extremely important. And as a summary, sustainable marketing in healthcare focuses on patient-centered digital communication, and that reduces environmental impact and provides long-term um, relationships with patients.
Touched very important parts. I recorded a video on sustainability because we're talking about it, and one of my friends back in Toronto, she basically said, "Well, you have to have education. What is the topic about?" So I record the first part, and so it's environmental, obviously economical, but also social. And social pillar is big because it intertwines with everything. The environment you mentioned many times, like paperless and so forth, energy savings because of that. But also social, meaning that making healthcare accessible for people, for more people, for those who are busy on the go or maybe have mobility issues and prefer to connect from home but still do exercise. I think those aspects are very important, and maybe like reaching out to more a bigger number of people than otherwise could come in person and visit the site. So
Abs-
this factor is very important. But you also mentioned something about digital automation. For the layperson, how does it work? So you have a post, and then it becomes like different platforms uploaded by
Yes,
itself, or
so there are certain platforms, there are different outlets in the digital world that can be used. Um, I can talk specifically of what, for example, the hospital I work for, we use. But there are many different platforms where you can upload, let's say, an image and a statement about a mammogram and how important mammogram is. And with one push of a button, you can upload it to all the media that you manage
I see, where you have
in a one
connection and
click.
account. Right, right, right.
Absolutely. Absolutely.
Right. I think leaflets is also as well also advertising. But you also mentioned about the channels, something I can see here, like in UAE, when you visit hospital, for example, I visit often Burjil, Medical City, you could see that there is a lot of digital aspects involved. For example, one department, you can see all the doctors, all the nurses who actually
Yes,
work, their faces, their names, and each of them may talk to you in recorded form about their specialty, the operations they make, or like visits, specific things that most of us don't even think about, but important to be vigilant about the your own health. So that helps to relate, even like you see the person before you visit, and it gives the real feel that it's human being there, and it's not just the name somewhere on the
no,
board
just
that you
absolutely.
can't
Yeah,
relate at
it's
all.
amazing. It's amazing how important videos of providers um, plays a role in patient decisions, right? You know, before we just used to get a referral to see a specialist or a doctor, and now I think most people are able to research that doctor, see how many surgeries that doctor performed, and to see if you are interested in seeing such a doctor. And I think that's an important aspect um, for any patient nowadays. And that has changed dramatically over, I think, the past couple of decades. Um, I've been in the healthcare sector since 1997, and that has changed dramatically.
Yes, exactly. It's like what is it now? 20, I'm afraid to
Six,
say 26 years.
2026.
So it's 29 years. That's true. So
Yes.
true. Actually, so true. One more thing you mentioned about the channels. So channels, like it's a real TV channel specific to the organizations. That's what you practice. Maybe you could speak more a bit
Yes.
about it.
So, yes, there are again special applications that there are different companies that provide vendors
Mhm.
that provide such channels, but you can have up to 20 different channels within one application, and it will send information to different monitors, right, to different TVs. Let's say you have one TV in the cardiology department, you have another TV in neurology department,
Yes.
and you can send you can set up your channels to um, to display the information just for the neurology department or just for the
Mhm.
cardiology department and what's pertaining to that department specifically, the events.
That's
And
amazing.
provide, let's say a new provider comes to the hospital, and you want to display that provider because that provider accepts new patients, and so that's
Mm.
an important aspect to convey to the public.
That's amazing. Another thing you mentioned is that, with Google reviews, your team, yourself, you can respond to most of their questions or comments, and they keep privacy. I think that's key because it's in a way trust, right? Like, I trust it with sharing
Absolutely.
something. And yes, perhaps I don't want to be public or publicized. Some people maybe don't mind it, but majority probably want to keep it,
Yeah.
for their own private kind of affairs. So for sure that's also beyond what you mentioned, that there is a policy and the compliance and all that, but it's also trust, right? It's more like
Yes.
relate with
But
a kind of.
uh, even if somebody online um, poses a question or things or makes a comment about their specific incident of healthcare,
Mm-hmm.
we are not able to respond um, to that specific event at all,
Mm-hmm. Okay.
because that would violate that person's privacy, even though that person is able to, legally, we're not able to do that. Um,
Got it.
so it's great to have reviews from patients online, and yet we're not capable sometimes of answering um,
Specific things.
certain situations. But we do always provide a phone number uh, that a patient can call back to and
Mm-hmm.
discuss their specific need or situation with a specialist. So
Right,
we
right,
make
right,
sure that those people know, the patients know that we're there to respond.
right,
We're
right.
always there
It's like there is a
for
connection,
them.
there is a feedback, it's not, you're not in
Absolutely.
solitude. You have community to connect. So that's key.
Exactly.
Yeah, so for the viewers, I just will sidetrack. When I introduced Galina, I was um, carried on so that I didn't introduce her as a speaker. So Galina Slezinger, she's specializing in marketing for many years, specifically in digital. But she
Yes.
started with education at Northeastern University and Bachelor of Art in Marketing. And then, as you mentioned, she started with working with the Brigham and Women's Hospital, first as the developer, program coordinator, many,
Yes.
many steps, and then digital marketing consultant at some point, and then switched to, I think, Brockton Hospital, Signature Healthcare Brockton Hospital, where she's a corporate digital communication specialist. So it's really
Yes.
digital throughout. I think you've seen it in the early stages when we just saw, okay,
Yes.
website is huge. Now it's beyond imagination, where it penetrates every step of the life, everywhere. In
That's
UAE,
true.
also see a lot with QR codes and how much they used. Even the cards now, business cards become QR codes. So when you mention QR
That's
codes,
right.
like,
Yes, it's funny because when I started in 1997, I worked for Brigham, and I worked for somebody who developed the first hospital listing in in the US. It was a listing of 100 hospitals, and it was one of the first listings ever. And I think the healthcare sector has come a very long way in terms of community and sustainability, digital sustainability in many, many ways.
yes, it's amazing. Here, even like appointments, they all come to your phone. Everything is in the phone. Sometimes it's an issue because I need to use magnifying glass because some things I cannot see straight away. But but it's convenient. It's always with you. You always aware what's happening. So in some ways, I think the only issue is that those who did not, learn or adopted digital. I think it's generational issue in many cases that they need help to get connected and
It is. It
yes,
is.
yeah.
I do have a theory that, um, you know, people live much longer lives now than they used to. And so I think one aspect that's not being looked at, and I have not seen it, is the fact that, and I cannot speak for other countries, but I know that in US there's a very large population of elderly people,
Hmm.
and they live not into their 60s and 70s, they now live into their 80s and 90s. And that sector, does have an issue with digital capabilities. And me, personally, I have an elderly mother who I need to help her digitally to click to approve, to prepare for an appointment, for example, for a healthcare appointment. A lot of elderly people are not capable of doing that, but there are many vendors and companies that do help elderly with those kinds of things, but I don't think it's I don't think people are looking at it in such a global view as, we have many, many elderly people, and that's where concentration should be also.
Yes, yes, like to bring a bridge, like they may pick it up, but just,
Yes,
somewhere, somehow to, make that link or reaching out so that they're not seeing it as a barrier, but, can kind of follow
yes,
the rainbow,
yes,
into this different world and start seeing benefits or, using it and just make it a part of life. So that's, I think, important. I guess organizations thinking about it is just you see sometimes that it is issue and it's generational quite clearly. It is an issue. So
yes.
thank you so much. We covered many topics. And I think for the viewers, very important to project that, okay, what is marketing? We often see it as basically, okay, face of the company. That's what the company does. But what's beyond, like the mechanism behind it's very rarely somebody truly talks because everybody busy, that's not the focus.
Yes,
But here, I think you kind of gave the view what happens on the other side so people can relate, connect, and perhaps it would be helpful for, visualizing or potentially choosing it as a profession, as a career path, because there is a lot
because
of
there is a
room
lot. Yes,
to be
yes,
there
there
and
is.
to kind of, connect and also to evolve. Like you mentioned, you started when it just began, and so you see all the evolution. And I imagine would be more coming.
I imagine so.
Yeah.
I'm
So
I'm trying to learn myself a lot about AI right now, so and how we can utilize it
utilize like for trending, perhaps, or
for trending, for data analysis, for again, how to use automation, you know, things like that.
interesting. Maybe one day we will talk about it once you have more
More
examples and
familiar. Yes,
yes, we can talk about because also this is I think for the viewers would be good to see it from again the inside. So it may inspire somebody to use it, somebody to take as a career step or maybe a niche they want to explore. It's always good to visualize things that we always tend to see the facade and don't know much more. But here with this conversation, I learned a lot about what's happening behind the scenes and how it reaches back to each of us because one
each
day
of
we're all
us.
patients and users of
Yes,
healthcare system and recently tends to be a lot, so it's yeah, it's good to connect. Yeah, so I think
wonderful.
yeah, we'll stop here and
Thank you so
yeah,
much.
thank you so much. Okay, I it didn't work somehow. Let me do it again.
What didn't
Just
work?
I think recording, did it stop?
No,
It didn't stop, right? Okay, I will
no.